Okay. All right, here we go. All I have to do, you guys, is welcome you here and turn you over to, like I said, the hostess with the mostest, our Sheila Price, our HR business partner here at ESI. We're so glad to have you, Sheila. Take it away.
Great, thank you. So I just wanted to welcome everyone to today's webinar. We are going to be talking about what's up for 2021. So first and foremost, I want to tell you a little bit about ESI, or E-Employer Solutions, Inc., and tell you a little bit about what we do. So we basically simplify your business. So what we want to do is basically take the back office work away from you and let you do what you do best, and that's generating revenue. And so that's what we do. We have great buying power with our partners that we strategize with. We have great effectiveness through our employment resources, and all of our employees are subject matter experts in our certain areas. So we definitely appreciate you letting us share a little bit about ESI. Appreciate you for joining today's webinar. So let's talk a little bit about what we're going to talk about today. So today's agenda, we are going to talk about OSHA. Next slide, please. We are going to talk a little bit about OSHA, and then we're going to talk about those lovely COVID reliefs and tax updates that none of us understand, right? And then we're going to talk about the Cobra subsidies. And then we are going to talk about policies and procedures, which is going to include unemployment. And we're also going to talk about the new Colorado law that includes paid time off. So a couple of housekeeping items. Everyone will be muted during today's presentation. So we do ask that if you have any questions that you would put those in that chat section, and we will gather those questions and try to ask questions after each presentation or each speaker. And also we are recording this presentation, so we will send out the presentation and the slides in a couple of days following today's presentation. We will also send out those credits once we receive those from the governing body of HRCI. We will also be sending you our employment guide, which is very cool. It has some tips, tools, and tricks for you to manage your business, and some hot topics that we're talking about today. And as always, this webinar is not suitable for legal advice. So we definitely ask you to call ESI, or we ask you to get with your HR professional or your legal professional in your industry. So next up, let's just go ahead and turn it right into our first presenter. So first and foremost, we have Michael Weaver. He is our risk manager at ESI, and I will let you read his bio on the page that you see there, but he has joined ESI, and we are so happy to hear from him today, and he's going to give you some great information. So I'm going to turn it over to Mr. Michael. Thank you.
Well, good morning again. Thank you, Sheila. I appreciate that. My name is Michael Weaver, the risk manager for ESI. So today I'm here to chat about COVID's, or OSHA's, new COVID National Emphasis Program and how it affects you as you and your business going forward. So I'm going to chat about the purpose of OSHA, the jurisdiction of OSHA, the authority, the violations, the citations. And then we'll get into the meat of it, which is the presidential order and the resulting national emphasis program that OSHA has done for COVID. We'll chat about the targeted industries, return to work program, and the penalties resulting from it. So to talk about OSHA's purpose is not really my purpose. I just want to bring it up to show you that even though OSHA is the safety police of the United States, they are not necessarily the bad guys. They're here to help us more than they are to citate us for any violations. So the second bulletin here is talking about the enforcement. All employers in the country have to follow OSHA standards. OSHA created their standards in the 70s. It's part of the Code of Federal Regulation, and the most important standard is the one listed there in the second bulletin, the General Duty Clause of the OSHA Act. It requires employers to keep their workplace free of serious recognized hazards. The second point here of this slide is to show you that OSHA has an on-site consultation program provided to all employers. It's a free program where OSHA will come out. It'll do an OSHA citation report on your business. There will be no fines issued, no citations reported, but they'll give you feedback of your environment and your operations, your safety protocols. And then for that year, you have immunity from any of those citations or violations found, but the purpose is for OSHA to work with you and to help you and educate and train, not so much to penalize and provide citations. So there are 10 regional offices for OSHA. The Texas one includes New Mexico, Oklahoma, Arkansas, Louisiana. There are 10 OSHA regions around the country. So OSHA jurisdiction, it is a federally enforced program, but they do not have jurisdiction authority in every single state. In the light blue states here, from Texas to Colorado down to Florida, you'll see that these states are practicing OSHA federal standards. There's 22 states plus an additional 6 states, 28 states that do not rely on OSHA standards. They actually enforce, they've created their own safety program. Even though they have created their own safety program, they still need to be at least as effective as OSHA standards. So OSHA is a federal enforced program, and they do have enforcement in Texas, Colorado, Florida, but not in all states. The other states, they need to create standards just as effective. This is to show the jurisdiction of where OSHA lies. So on the next slide, we'll talk about the authority, the violations, and the enforcement. OSHA receives their authority through the Code of Federal Regulations. It was written in 1970. And those regulations were written in language for 3 separate industries: the general industry, the construction, and the maritime. If you're not in the construction or the maritime industry, you're in the general industry, and COVID or OSHA regulations apply to you there. The authority for OSHA comes through the standards that were created, and those standards are safety and workplace health regulations. The violations come where OSHA can issue a citation for not following a certain violation. And it's not OSHA that actually enforces it. The enforcement of those citations actually are passed on to the Occupational Safety and Health Review Commission. This is a separate independent federal agency, separate from the Department of Labor, separate from OSHA. It's actually comprised of 3 judges. If you do find yourself in front of the Occupational Safety and Health Review Commission because of a citation, you actually won't have the ability to argue against whether or not the citation or the incident, the hazardous incident, could have happened or should have happened, or whether or not it was severe. The enforcement is only whether or not the citation was interpreted correctly when the OSHA compliance officer gave you a citation. The review commission is to make sure that the citations are interpreted and applied correctly with the standards. So if you do find yourself in front of the Occupational Safety and Health Review Commission, your best defense would be to argue against the interpretation of the standard being applied, not necessarily that something bad would have resulted or how bad it would have resulted, but whether or not it was interpreted. So the authority is given to OSHA through the Code of Federal Regulations from the 70s. They get that through the citation, but it's enforced from a completely separate review commission. So moving on to the next slide, we're going to talk about those OSHA standards. So when it comes to COVID, there actually is no specific standard related to COVID. There is no specific standard, but the most important standard is the general duty clause. And you can see right there, there's a link. You can click on it and go direct to it in the OSHA's website. But this general duty clause is for employers to provide a safe and healthful workplace that is free from recognized hazards. And right here, the word recognized is the most important part of this. It's where the emphasis needs to be applied. If you recognize the hazard, then mitigation needs to be taken. And mitigation for COVID can be done, can be followed through the next 4 bulletins. Requirements of PPE, respiratory protection, sanitation, protection from bloodborne pathogens. Then the last one would be the medical records, is to release them to OSHA when required, but also to conceal them when necessary. So the general duty clause, it is meant for you to provide a safe and healthy workplace free of recognized hazards. So if you recognize the hazard, then you have to mitigate it. And when it comes to PPE, then we can see on the second bulletin right there that PPE is a requirement that needs to be supplied by the employer. And the PPE requirement is so broad that it doesn't say all the PPE you need to supply. It actually says the two things you don't need to supply. The two things an employer does not need to provide are steel-toed boots and prescription glasses, prescription safety glasses. Although if any of those PPE that is supplied is already broken or misplaced, then the employer still has to replace that as well. So COVID is not being cited under a certain clause, but the four regulations, four standards that they are being issued are under the non-enforcing PPE, non-enforcing respiratory protection, non-enforcing sanitation. These are the most important ones to know in regards to the COVID and OSHA violations. All right, so moving on, we'll see that OSHA did not have any specific COVID-related standards. Even though since the pandemic started, OSHA has issued over 300 citations related to those four standards that I just showed you. They issued over 300 worth $4 million. Even though those were COVID-related violations, they still aren't COVID-related standards. So even though OSHA issued over 300 citations last year, President Biden still wanted more to be done. He wanted a mask mandate, national workplace mask mandate. So January 21st, President Biden issued a presidential order for OSHA to conduct an evaluation on whether or not there needs to be a national mask mandate and what enforcement needs to be done. There's a link right there at the bottom for you. But two of the bulletin points to know about the presidential order is that Biden wanted to review the standards, the enforcement efforts of whether or not we were holding people accountable. And then the second was that we were not doing anything retaliatory, that employers were not being retaliatory against employees for whistleblowing or for complaining about their employers. So two of the most important points to remember from the presidential bulletin order is that Biden asked for stronger mandates and that he asked for anti-retaliation principles or practices to be done. So going forward, we see that moving on to the next slide, we'll see that this created a national emphasis program. So Biden's request gave OSHA 2 months until March 15th to supply a remedy to his request. And their response was a national emphasis program. And that's not something new to OSHA. There are a list of national emphasis programs that OSHA has in place right now. They range from combustible dust to lead to ship breaking, because now that's a big deal going on. All the way to our latest one, which is the COVID National Emphasis Program. And a National Emphasis Program is a temporary program that is for either high hazard industries or high hazardous situations. And so OSHA's response to the presidential order was this COVID National Emphasis Program. And moving on to the next slide, we'll see that on March 5th or March 12th, March 15th is when President Biden requested them to have a response, OSHA to have a response. They responded and replied with the National Emphasis Program on March 12th. Then 2 weeks after that is when it started happening, when it went into effect. And we can see here from the May 12th dates here that these are the dates for those other 28 states that are not under federal OSHA authority. Those other 28 states had 60 days in order to supply their national emphasis program. They had to create a program at least as emphasized or as effective as OSHA's program. And so these are the dates for it. So the NEP program is already kicked off and started as of March 26th. So the program, the National Emphasis Program, is broken down into two distinct parts. The programmed results from the National Emphasis Program and then the unprogrammed results. The program results are actually just an emphasis for OSHA to inspect high hazard industries. So in their National Emphasis Program, OSHA's response wasn't actually to create COVID related standards. They didn't do anything as far as enforcing masks to be worn or enforcing any COVID related standards. But what the response was is saying, we'll pick the high hazard industries and then we'll conduct more inspections more frequently. And so programmed inspections, that is the first part of the National Emphasis Program. And we can see that the goal is the bottom bulletin is to show that the goal is at least 5% of OSHA's total inspections. So there's going to be 1,600 inspections, 5% of the total is going to be designated for high hazard industries in the National Emphasis Program. And because there are 10 regional offices, OSHA is broken up into 10 regions in the United States. That's roughly 160 inspections will go to each, but the Dallas region, the Texas region is included New Mexico, Oklahoma, Arkansas, Louisiana, and Texas. So those 5 states are going to get roughly 160 inspections for high hazard industries. So the chances of any one of you being inspected based on the National Emphasis Program is slim. But there are 2 parts to this National Emphasis Program. There's the program inspection based on high hazard industries, and then there's the next slide. Moving on to the next slide. These are the list of the high hazard industries. They're by the NAICS code. So there's targeted industries within healthcare and targeted industries that are non-healthcare. Of the 300 citations that are issued for $4 million of last year that are related to standards that have to do with COVID violations, then those were the dominant majority of them were in health industry. So you can see that OSHA is going to continue that trend. These are the industries that if you're in, there's a chance that OSHA will randomly pull your name out of the hat of the 5% inspections they need to do just to see if those other 4 standards are being followed. This is the program side of it, first part of the program side. The second part is on to the next slide is the second way OSHA is going to determine to inspect you is based on last year's OSHA 300 form. Now, this is the annual form that all businesses need to, or businesses in certain industries need to turn in based on previous year's claims and the info related to it. And if there are any OSHA related injuries, illnesses, or deaths on that OSHA 300 form from last year, then OSHA is going to put your name in the hat as well and add that to the programmed list of inspections. So the National Emphasis Program, in summary, is going to is in 2 parts: the high hazard industries in the list we just saw, and the second part is based on last year's OSHA. Unprogrammed aspect is the other 95% of the inspections that OSHA is going to continue doing for the year. And there's 3 ways that OSHA is going to come to your job site. There's 3 ways. There's a fatality or catastrophe. If there's a fatality in your business, then it needs to be reported within 8 hours. And because of that, OSHA will do a visit. They may issue fines or citations, and they can do that after the fact. The second way they can visit is through complaints or referrals. This can come from a vendor, it can come from an employee, and it can come from anywhere. Any complaint, OSHA will determine based on the complaint whether or not they need to inspect. And the third way is through imminent danger. And so that is small examples, and OSHA compliance officer can be on his lunch break and he could see someone working on a roof without any fall protection, and he can walk on site and issue the citations. So the other 95% of the inspections that OSHA is going to do for the remainder of the year are going to deal with either a fatality, a catastrophe, a complaint or referral, or imminent danger. And a complaint or referral can come from your own employees. And if they think that you're not honoring or abiding by or respecting the pandemic, then OSHA can deem it necessarily to come by. And if OSHA does come by, there will be a follow-up. One of the good things about OSHA is that even though they are the police of the safety world, they don't want to penalize you and walk away. They actually want to see you make right by what happened. That's part of that on-site consultation program they offer, but it's part of why they do follow-ups. It's not to make sure that they get paid. It's just to make sure that you practice safety, you mitigated the hazards, and you made right by your employees. So those are the 2 aspects of the National Emphasis Program. So moving on, if you do have an employee that does get sick, the OSHA does not have any standards or guidelines for this. Well, they prefer for you to follow CDC standards and guidelines. If you have an employee get sick, they need to go home immediately, and your business needs to be sanitized. because that is a recognized hazard, if an employee is sick, does stay home, or comes back too soon, OSHA can cite you for any of the other 4 violations: not supplying PPE for anyone, not giving respirators, or they can cite you under the general duty clause. So returning to work after COVID is something that should be practiced. And one of the main aspects of the National Emphasis Program was anti-retaliatory, not to penalize anyone for staying home or for taking the entire isolation or quarantine period, and also for protecting the records of those who have been vaccinated versus those who have not been vaccinated. There should be no distinguishing at all between employees who have been sick, who have not been sick, who have been vaccinated or not been vaccinated. So when it comes to return to work, even that needs to be followed to the highest degrees, because OSHA can still issue a citation for not following that. So moving on to the next slide, we'll actually talk about the penalties. So OSHA takes it very serious. The very first violation is worth $13,000. That's the minimum. That's the minimum violation. OSHA gives you a chance to fix and correct. So with every citation they give you, they'll give you a follow-up time period. Hey, we'll come back in 30 days. We want to see that PPE was supplied, or that you sanitize, that you have practices. Mostly, they want to see that you put in a framework of standards or procedures to mitigate the hazard, a hazard that you do recognize. So if you don't fix or correct the penalty, they can charge you $13,000 per day. So if they gave you, OSHA gave you 30 days to fix something, and they come back 45 days later, they can charge you 15 days worth of $13,600. And if they feel that what you did was willful or repeated intentionally or negligently, then it can be $136,000 per violation. So OSHA is taking this very serious. So in summary, the National Emphasis Program did not create OSHA or COVID-related standards or guidelines, but what they did was create an emphasis on inspecting high hazard industries and using the other 4 standards that we discussed to enforce COVID indirectly. And for now, that's the end of what I've got.
Great. Thank you so much, Michael. That was great information. It looks like we do have a couple of questions that came in. With Texas's mask mandate lifted, do employees still need to wear a mask at work?
Well, yes. Unfortunately, yes. This comes down to the general duty clause, and the general duty clause specifically is a last chance, last ditch, or the fallback standard that OSHA can fall back on. In safety and health, OSHA created a standard for every recognized hazard, from fall protection to from a roof, from slip and fall to electrical standards. They created a standard. And if there is no specific standard to create, they have the general duty clause. And that means you have to protect your workplace from recognized hazards. And unfortunately, because we're in a national federal pandemic, OSHA has federal authority over Texas. Texas is not one of those states where we create our own safety plan. If Texas were, then that mandate that was lifted by Governor Abbott would have been effectual in the workplace. Instead, OSHA is federally enforced, and the burden of proof is on the employer to say that the recognized hazard of COVID is not present in their workplace. But unfortunately, we're in that period where COVID is a recognized hazard. We're still in a national pandemic. OSHA has federal authority. So in Texas, it is still enforceable. Now, there's no standard that says you must wear a mask, but there's a standard general duty clause that says if you can recognize a hazard, you need to protect. And that includes PPE, which can come in the form of the clear plastic glass in front of you and the customer. And it can come in the form of your mask, or administrative controls with shift in schedules, or engineering controls as paths and making sure people don't overlap. But yes, unfortunately, you still have to wear a mask in Texas.
Great, thank you. I think that's pretty important to remember. So we do have some other questions, and we will ask those maybe towards the end to ensure that we have time and get all of our content in today. So we are going to move on to our next speaker. Thank you very much, Michael. We are going to move on to our next speaker. Her name is Jenny Smith, and she is the Vice President of Accounting and Finance at ESI. And again, you can read her bio that's on the slide here, but I'm going to turn it over to Jenny, and she's going to tell you about the aspects, financial aspects of COVID and some of the new tax credits and laws that came out. Thank you, Jenny.
Sure. Thanks, Sheila. Good morning, everyone. So many of us have become very accustomed to looking at the PPP. You know, it feels like it's been forever since we've been hearing about it. So we're going to touch on a brief update on the latest extension of the PPP loan, the employee retention tax credit. There's been several revisions of that, and we'll touch base on the latest revision of that and the expansion of that. Then we'll talk a little bit about how those two interplay with each other, as well as address some commonly asked questions that we've been hearing. Okay. All right, so regarding the PPP program, on March 30th, the president signed a 60-day extension. So now the deadline is now May 31st for employers to apply for that. Those that are processing those applications have until the end of June. So if you think you've missed the boat on that, or you weren't sure, I would definitely encourage you to see if this is something that makes sense for you. There's still time to do that. If you are a client of ESI, we have ready-made reports ready to provide you. Once you get with your banker or your CPA, they'll have a request of the items that you need, and we can help pull the payroll-related items for you and walk you through that process as well. So next slide, please. Okay, so the ERTC. So it's hard to keep track if you're, this thing has evolved quickly, and so I kind of want to just review in general what that credit is and then touch on how it's kind of evolved. So as a reminder, the ERTC is a fully refundable payroll tax credit. The point is to incentivize, to help businesses keep and compensate their employees. So basically keep everybody employed as much as possible. So, so to claim the ERTC, an employer must meet one of the following criteria. They are fully or partially suspended their operations, or they had a significant decline in their gross receipts during the calendar quarter compared to 2019. So those are two things to consider to determine if you even qualify. So obviously there's some numbers involved. Definitely encourage you to go through the exercise, even if you think it might not be for you. It's a good thing to know. Okay, next slide, please. Okay, so the new law, the most exciting thing that probably has happened is that in latest revisions of this, now where the initial 2020 versions of these laws, you could either get the PPP or you could get the ERTC, but you could not get both. So, and as we've learned, there are different things covered by the PPP. It covers a little more and expands a little more into some of the expenses it may cover. So the new law allows a company to claim the ERTC in addition to the PPP, potentially, if you're not, as long as you're not double dipping, and your ERTC, you can now retro back to March 12th, 2020. So if you got the PPP loan in 2020, but you did not take advantage of the ERTC, now you potentially could have additional funds you could recover based on that year. So as a result, employers, how that credit is to be taken is on your 941. So as we know, the 941 is filed on a quarterly basis. So all the 941s for 2020 have already been filed. So how those credits are recovered is through a revision of the 941s, which pulls down a credit down to the bottom of that tax return and then provides the credit to the employer. So that's how those credits are recovered. So if you're an ESI client, we actually handle all of that for you. It's in terms of calculating the credit, we have resources and partners available that will help you walk through that entire process. Okay, next slide. So one big question we get is what wages qualify for the ERTC? So there's a couple of things to consider. One is if you're a large employer or you're a small employer. So, and that has changed, that definition has changed over the course of this, and we'll pop up a summary slide here in a second that will show you that. So for a large employer, it's what wages are considered is very different. So it's it's a little more stringent in terms of wages paid to employees for the time they are not providing services. However, with smaller companies, wages they've actually paid. So there's definitely a little more broad coverage for the smaller companies. So in terms of determining whether you're a large employer, so you could be on the fence of, you got 99 or 101 employees. So large employers, how that's determined is by counting the average number of full-time employees during 2019. So, and then full-time employees, how that's determined is if the employee worked more than 30 hours or more in a week, or 130 hours in the month in 2019. Okay, next slide, please. Okay, so here's a summary that we've kind of talked a little bit about this, but I like the visual of being able to see how this has evolved. So the interplay with the PPP. So again, no ERTC originally with the PPP. However, in 2021, you are able to do both, and we're able to retro back for the ERTC, potentially. Again, no double dipping. The maximum creditable wages per employee was $10,000 per year versus the new law is $10,000 per quarter. Maximum credit, so 50% up until recently, until the new law for effective for 1/1/21, it was 50% of eligible wages up to $5,000 per employee. Now that's 70% of eligible wages up to $14,000 per employee. So the potential credit over the course of 2020 and 2021 is potentially $19,000 per employee. And here's kind of the summary of the large employer versus the small employer. It was more than 100 qualifies you as a large or makes you a large employer, and more than 500 now for 1/1/21. So basically the newest law has basically made this available, the ERTC available for many more employers because of the size expansion. And as we know, smaller employers have been hit extremely hard during the pandemic. Okay, next slide. So commonly asked questions that we're hearing: can I get the PPP loan in the ERTC credit? Potentially. So definitely go through the exercise of both of those and see what you're eligible for. How do we go about getting the retroactive tax credits? So we have a vendor. If you're a client of ours, we have a partner, and we have resources internally to help you determine, one, if you're eligible and how to calculate that. And then we manage that through the 941 process. If you're doing that internally or with another payroll partner or PEO, they would help you with that. But you still need to determine what that credit is. But they would need to, depending on if you're on your own FEIN or theirs, that becomes a question. How do I get my payroll related data for the PPP loan process? So if you're a client of ours, we have built custom report packages that can help you do that. And first, what I would encourage you to do if you're kind of starting that process is talk to your banker and talk to your CPA, and they're going to tell you what they need. I've seen a variety of request lists. So definitely, in order to not waste your time, I would get that list first and then talk to the people that are doing your payroll. And who can help me with the PPP loan process? So if you're a client of ours, of ESI's, we can help you do that. Again, your CPA, if you're not, or even in conjunction, your CPA or your banker would be able to help you with that, along with whoever's doing your payroll. Who can help me with the ERTC qualification process? So we have great people on staff and partners that take you through that entire process if you're a client of ours. So definitely reach out to your HR business partner and they can put you in touch with them. Okay, that's all I have. What questions do we have?
Thank you, Jenny. Whew, I don't know about you all, but that was some great information. Definitely confusing a little bit as far as the ERTC and the PPP. So looks like we do have one question. If a company received the first PPP loan, are they eligible for the second PPP round loan?
Potentially. There are different criteria, so they definitely want to explore that. And I'm happy to reach out and provide some additional details on that.
Great, thank you. It does look like we have a couple more questions, but it looks like you answered those in the Q&A section. So we will move on to our next speaker. Thank you again, Jenny. So our next speaker is Ms. Taryn Walker. She is our benefits manager at ESI, and Ms. Taryn is going to talk about Cobra subsidies and other information such as that. I'm going to turn it over to Ms. Taryn. Thank you.
Thank you, Sheila. Good morning, everyone, and thank you for attending our webinar today. I'm sure you guys have been involved in a lot of different webinars providing information, so we also wanted to make sure that we were providing you information up to date as well. So I'm going to be talking about ARPA, the American Rescue Plan Act, in relation to Cobra specifically. So on March 11th, President Biden signed the American Rescue Plan Act into law, which created Cobra subsidies and tax credits to employer. The Cobra subsidies are allowing potential qualified AEIs, assistant eligible individuals, an opportunity to have their Cobra payments subsidized from April 1st, 2021 to September 30th, 2021. The reason I call them potential AEIs is because there are some qualifications in there to determine whether someone is or isn't eligible in respect to the timelines, and we'll talk a little bit more about that as we move forward. So the premium assistance is available to cover the cost of Cobra premiums as under federal as well as under state continuation coverage. An assistance eligible individual would not be required to pay their Cobra premiums or the administration fees for the periods of April 1st, 2021 through September 30th, 2021, respectively. At this time, we have a definitive start date and a definitive end date. And that's important because if a AEI was eligible for Cobra prior to April 1st, 2021, or their benefit duration period extends after September 30th, 2021, those months prior to and those months after would not be considered eligible, as the premium assistance subsidy does not exist for months outside of this specific time frame. An employer who is paying the Cobra premiums on behalf of an AEI would be eligible to take a tax credit on their 941s for the premium assistance for the total cost of, sorry about that, for the total cost of the premium as well as the administrative fee. And that would be done quarterly on the 941s. We're definitely able to help you with more information on that. You can either contact accounting at eesipo.com or benefits. And when you get the slide deck, both of those email addresses will be in there for you if you have specific questions on that. The assistance subsidy does apply to the medical, dental, and vision plans. So it's not specific to medical. That's something to keep in mind, and it's contingent upon how someone was already previously enrolled in the plan. Next slide, please. So let's talk about who is an AEI. An AEI would be any Cobra eligible participant within the past 18 months prior to April 1st, 2021, of whom met some of these particular criteria. They experience an involuntary termination. So voluntary terminations, of course, are excluded. Also things such as qualifying events like divorce and marriage that could potentially lead to Cobra situations are not included in this provision. If an employee experiences a reduction of hours, they can potentially be in AEI. The thing to keep in mind there is reduction of hours can be voluntary or involuntary. So if an employee went from full-time to part-time, that could potentially qualify them. If a employer reduced operating hours, therefore an employee had a reduction in hours, that could potentially qualify them as well. If a employee elected Cobra prior to April 1st, 2021, and has not exhausted their benefit duration period, they could potentially be an AEI. If an employee did not elect coverage and has not exhausted their coverage period, then they are afforded a new opportunity to enroll and could potentially be an AEI. One of the disqualifiers is an AEI cannot be enrolled on another group health plan. And that's why I use the word potential. And as we go through the process of notifications and notifying the correct population, that's where you're going to determine whether they do have other coverage and if they are eligible for this plan. Another key thing that I want to point out inside of ARPA is it is not specific to specific to COVID, forgive me. So what that means is the termination does not have to be specific to COVID. The reduction in hours or status change, full-time, part-time, does not have to be specific to COVID. So if an employee simply was terminated for performance, let's just say, they could potentially become an AEI, contingent upon whether they have access to other group coverage or are enrolled. A Cobra eligible participant is defined as someone that is currently enrolled or was enrolled on any of the applicable coverages on the day of the involuntary termination or when the reduction of hours happened. So what that means is this provision does not allow for someone who wasn't previously enrolled in the plan to enroll in the plan. You still have to be a qualified Cobra eligible participant per standard qualifications in order to be considered an AEI. Next slide, please. So let's talk a little bit about the timelines for subsidies. The key dates that we want to keep in mind for someone to be subsidy eligible is April 1st, 2021 through September 30th, 2021. Regardless of when someone's eligibility, the subsidy does not extend before or after those dates in current state. So just kind of talking through a few scenarios. If you have an AEI that's newly eligible as of April 1st, that AEI would have subsidy applied April 1st through September 30th. And then for October 1st, should they continue Cobra coverage, full premium at this point would be due to the employer group by the AEI as identified without any subsidy applied to it. If you have an AEI that's already elected Cobra, so they are already on Cobra, they are already enrolled and had been currently paying premiums, for the months of April 1st, 2021 through September 30th, 2021, that AEI would no longer be responsible for having to submit premium in for their Cobra coverage. For any months they continued after September 30th, 2021, of course, they then would be responsible for full payment should they decide to continue coverage. You also have situations where people enroll in coverage and then drop coverage for particular reasons. If you encounter that, that person is also considered a potential AEI. They must be allowed a new opportunity to enroll in coverage again if they are still within their 18-month benefit period. The subsidy again would only apply to those specific months, 4/1 to 9/30, contingent upon what's remaining and available for their Cobra benefit period. So if they have 10 months left of applicable Cobra coverage, they could potentially take advantage of this particular subsidy from 4/1 to 9/30. And then any month after, if they continue coverage, they would be responsible or dropping per regular Cobra guidelines. If your AEI has not yet elected coverage at all, they must be allowed an extended notification period, which would be 60 days after the notification, allowing them an opportunity to then again re-enroll in the plan. So that 60-day notification is going to be based on the new notifications that we're sending out that's going to let people know what their options are for enrolling. The subsidy again would only apply for those specific months, and it's all going to be contingent upon what an AEI has available to them as Cobra options. So if an AEI excuse me, exhausts their Cobra 18-month eligibility in the midst of the subsidy period, their coverage will end at the end of their Cobra eligibility, and the subsidy will then end as well. So these are going to be very fluid moving dates as we move through that, which is going to require anyone to do some significant record keeping and notification just to ensure that billing is happening appropriately, as well as eligibility dates are being exhausted and utilized appropriately. Next slide, please. So what do you do now? This is where a lot of the work and the meat comes in. This Cobra subsidy will create a significant amount of administrative work for anyone that is administering Cobra. The reasons for that is you do need to begin to identify the correct Cobra population. So you would want to separate the voluntary terminations from the involuntary terminations to ensure that you are not affording opportunity to the wrong population of people. This is also going to require new notifications out to any potential AEIs. The DOL was slated to have the model notices made available to us as of April 10th. If anyone has not noticed yet, those were released yesterday morning. So feel free to jump over to, not right now, stay with me, but feel free to jump over to the DOL, and you can get those notices. From there, what you're going to want to do is you're going to want to figure out, do you want to use this notice? Do you want to incorporate this notice or this language into what you're already using? And then those notices are going to need to be mailed out. As of right now, as best we know, they need to be mailed out the exact same way that we're mailing Cobra notices now to any potential AEIs. You are required to do an 18-month look back for potential AEIs, which means you do need to identify potential AEIs all the way back to November 2019 in order to ensure that you are sending notices to the correct population of people. In those notices that are on the DOL, it does ask, there are some wording in there that does ask as far as if someone has other coverage. And that's something that's going to be important for you to utilize, whether you use that notice or use your own notice, because that's going to be the area in which you begin to determine qualifying methods or disqualifying methods for potential people in order to control costs and enrollment. You do need to have those mailings sent out within 60 days of April 1st. So all the notifications do need to be mailed by May 31st, 2021. And then one other thing that was added because of the subsidy is you do need to notify an AEI at least 45 days to the end of their subsidy and no less than 15 days from the end of their subsidy that their subsidy date is ending and what their next steps and options are. If I can give you a great suggestion, I suggest that you partner with a solid source that is leading in the industry and well-versed in what needs to happen in order to keep you as compliant as possible. If you're currently a member of ESI, and I hope that you are, please know that we have already began identifying the correct Cobra population, and we have already began identifying how we will do our mailings and our letters and notifications as a service provided to you from partnering with ESI. This is something that we will take care of for you. If you are not currently partnering with ESI, this may be another opportunity for you to come back around and give us another look. This is a place where we help you simplify your business, keep you compliant, and take a lot of the administrative work, knowledge, and legislation off your hands. If you're currently using a Cobra vendor, I strongly suggest that you have a conversation or reach out with your Cobra vendor just to make sure you understand exactly how they're going to process this for you, that they have the correct data. You definitely want to make sure that you're staying in compliance and that you and your vendor are on the same page for doing that. Next slide, please. All right, so questions. One thing I do want to say before Sheila starts reading those questions, if there are any, is if you have any specific questions to your situation, please feel free to email benefits@eesipeo.com. My team is ready to evaluate your specific circumstance with your specific benefit plans and advise you accordingly. Thank you for your time.
Thank you so much, Taryn. That was some really pertinent and important information, especially about those Cobra notifications being mailed out. We do have a couple of questions. However, in the interest of time, I'm going to go ahead and move on to our next speaker. And if everybody wants to, they can stay on afterwards and we will ask some questions afterwards. So next up is Cheryl Zang. She is a human resource business partner at ESI and my partner in crime. Cheryl is going to talk about policies and procedures and some new things that are coming up very shortly with new laws and things like that. So thank you, Cheryl.
Thanks, Sheila. Thanks so much. All right. I'm also the slide mover forwarder. So, all right, we're going to touch on a few things that have come up. You've already heard the name ARPA. That's the newest legislation that came out just last month. And there's a few more things I'm going to throw in there for you. This is basically a recap of where we've been at with the emergency paid sick leave and the extended FMLA. Those were affected with this new law with the ARPA. And so I'm giving you a summary here of where we were. If you remember it, this is where employees could take time off. There's 6 different qualifying reasons. that they could get paid for being off for COVID-related issues. That was April 1st through December 31st. In December of this year, I'm sorry, in January of 2021, that law was renewed, so to speak. So basically, the FFCRA regulations are the same, the 6 criteria, how you manage it. But now, instead of it being required during the first quarter, it was voluntary. You as an employer could decide if you wanted to offer it. If you offer it, you get a tax credit on your payroll taxes of the full amount of the actual wages that you pay the employee, not just the employee's taxes. So it kind of was a benefit for both. Of course, not if you're short-staffed, but in some of these scenarios, people didn't have work that much for staff. So it could kind of benefit both. So you could opt in during the first quarter. Now you can opt in again for second and third quarter under the ARPA, but now there's a lot of changes. So we're going to go through those. Okay, EPSL and EFMLA have been extended. That means now they're going to go through September 30th. We are expecting that you can pick and choose. Do you want to do EPSL? Do you want to do EFMLA, or both, or neither? But the official DOL guidance on that is still pending, but that seems to be the way that we're going. If you do one of these and you opt in so that you can get the credit and your employees can get time off, you do have to follow all the regulations, including the new ones I'm going to show you. You don't get to just take like parts of it. You can set your own kind of like compassionate time off that you want to pay your employees. But if you call it EPSL and EFMLA and you want to get the tax credit, then you've got to follow all their regs. Okay, it was also reset. So what that means is in April of last year, everybody got 80 hours, 2 weeks of this EPSL, if you're an employer with 500 or less employees. And then in the first quarter, when it became voluntary, we were still in that first 80 hours, right? Well, now April 1st through September 30th, that starts over. So if somebody used 50 hours and they had 30 hours left from last year and Q1, they don't get to take that over. Now they have 80 plus 30. That's not what we're doing. And you can't take the credit that way. So just know everything that was is over and everything starting new. You can take the credit again. So if someone took 80 hours last year, they can take another 80 hours if they have the need and they qualify, and you could also take that credit. So the reset is 10 days, so 2 weeks. This includes, remember, part-timers, temps, everybody. Is not just a benefit for full-time employees. The tax credit restarts and the EFMLA tax credit restarts. So that means the 12 weeks, I'm going to show you in a minute, could technically restart and you could get another tax credit for 12 weeks. However, there's a question about how FMLA renews. So for example, when you're dealing with your regular FMLA, it renews on a calendar year or a rolling year. So what, is everything going to stop in April? We'll get more clarification on that. Okay, expanded means there's new rules. I'm going to let y'all look at this slide later because my little graphs are going to show you. Okay, so expanded means here's the original qualifying reasons, 1 through 6 for emergency paid sick leave. The left side, right, whichever mirror image, is the regular rate of pay. The other side is 2/3 of their pay. You see reasons 1 through 6. Most of us are familiar, and I've got it right there. So you see what it was. This is what it is now. It's 7, 8, and 9, 3 new qualifications. You can see they're under the regular rate of pay, so the employee gets 100%. And these involve the vaccines. So if you're getting a vaccine, if you have side effects from the vaccine and you have to be out, or the 9th one, if you're seeking or waiting for the results of a COVID-19 test or diagnosis, and you've been exposed or your employer requested it. Those two last caveats were not included last time. So people who were exposed and knew they had to stay away didn't qualify for the EPSL, and they do now. Here's the EFMLA differences. This is important. The EFMLA last time only counted for the child care reason, and you can see it there in a little more detail. Now, it's all 9 of the EPSL qualifications are also EFMLA qualifications. Oh, let me show you that. And that $12,000, that was $10,000 previously. That's because the 10 days that were unpaid. So 2 weeks were unpaid, 10 weeks were paid. The employee still got 12 weeks. Well, now all 12 weeks are paid. So that total increased a bit. All right, let's go through some unemployment benefits quickly. I want you to know these are out here. I want you to know that they've been extended through September 6th, and you can see the different kinds. The self-employed gig workers, the $600 a week from last year, that's now $300 a week. That has been extended through September 6th. And then there's the final one, the PEUC lengthens the time for people who have already exhausted all of theirs. So no, these are out there. Your employees may be using them. And then I want to cover, even though I know I got to wrap this up, fraudulent unemployment claims. They've really skyrocketed. I'll tell you, in one state, they did normally before pre-pandemic, every year they did about 1,100 fraudulent claims. In 2020, it was over 224,000 suspicious claims. So this isn't one state, it's everywhere. It is because of the pandemic. It's because there's so many people qualifying for unemployment. There's so much money being thrown out there by the federal government at unemployment that the criminals are trying to benefit from it. And what they do is they file a fraudulent claim. If they file a claim in someone else's name, and banking on the fact that your employer will not respond. Because if they don't respond and the criminal put layoff, they're automatically going to qualify and they'll start getting money. So there's some things that we can do, and you'll see all the other FBI, DOL that are involved in addressing this, and each state is too, and ESI is as well. We're very actively following this and addressing it ourselves for our clients. So what can the employer do? Respond quickly and accurately. Don't let an unemployment notice fall in file 13 or get stacked under a bunch of stuff. Okay, that's why we do for our clients. We've got a system that runs like clockwork. So set that up at your office if you don't have a provider like us. And make sure when that person's out that you assign somebody to take those over. Also, with some of the reduced work schedules due to severe weather, the COVID, some people are qualifying for reduced hours. So they are qualifying for unemployment. So if you see that you get a claim for Jane and Jane couldn't come to work because the whole office was shut down during the snow in Texas a few weeks ago, oh yeah, okay, Jane must have applied, but you need to ask. Just make sure. Maybe she didn't apply, maybe it's one of these fraudulent claims. So start asking, it really is going to help a lot. And what can an employee do? These are some steps they can take. It involves contacting the Workforce Commission and then some national Federal Trade Commission identity theft and some other resources. We're working with our employees as this happens and sharing this information with them, and they're able to take some steps to help them out. That's my time. Do y'all have any questions? Sheila?
Hi, Cheryl. Thank you very much. That was very pertinent information. We do have a few questions, but in the interest of time, I'm going to go ahead and thank you and turn it over to Miranda, who is our next speaker. So Miranda is another one of my partners in crime, and she is an HRBP with ESI in our Colorado market. So she is going to talk about the Colorado paid sick leave laws that were just enacted. Hand it over to you, Miranda.
Thank you, Sheila. And guys, I will try to wrap this up quickly. I know that we are over our hour, so we appreciate you staying on with us. So this is going to be for all our employers that have employees in the state of Colorado. So beginning of this year, the Healthy Families and Workplaces Act went into effect. And there's two parts to this act. There's the paid sick and safe time, and then the public health emergency leave. Next slide. Thank you. So on January 1st of this year, any employer that has 16 or more employees, they needed to start providing up to 48 hours of paid sick leave to their employees. And then any of the smaller employers with 15 or less, this will go in effect for you in January of 2022. So I do want to note that this does include all employees. So the full-time, part-time, on-call, temporary employees, anyone that you're paying through payroll needs to be included in this. So as I mentioned before, it's 1 hour of paid sick leave for every 30 hours worked. And then if you currently already have a PTO policy that has the sick and the vacation kind of all rolled in together, as long as you're giving them at least 48 hours, then this would satisfy the requirement. So this slide just shows the reasons that an employee would be able to take paid sick and safe time. So I'll just quickly go over this. So if the employee has mental, physical illness, injury, or health condition that would prevent them from working, if they're caring for a family member who's dealing with a health condition or injury, if the employee or a family member is a victim of domestic abuse, sexual assault, or harassment, this would also qualify. And then if there's a public health emergency, which obviously we're currently in, and the employee's place of business or their child's school or childcare is closed, that would be another qualifying reason for them to take paid sick and safe time. So then the second part was the public health emergency leave. And so this went into effect January of this year, and this is for all employers. So regardless of size, one employee up to all employees, this would be, everybody needs to comply with this. And unlike the FFCRA leaves, this is not voluntary. So unfortunately, this is required of all employers to pay this or to provide this to their employees. So this is up to 80 hours of paid sick leave. And there's not the different levels. So for the qualifying reasons, it's 100% of their pay. And then this is also for all employees. So full-time, part-time, on-call, temporary would be eligible for this leave. And then it's up to the 80 hours. So it's really dependent on if they're full-time, part-time, they would not be eligible for the 80 hours. So we certainly can kind of talk through that stuff. And then I know there's a lot of information on this slide, so we can certainly talk through it, but these are the 6 reasons, and they're very similar to the FFCRA reasons of why an employee would qualify for this leave. As I mentioned before, they need to be paid at their same rate of pay or salary. And then if they're able to work from home, they would not qualify. So if they're able to work remotely, then, they still are, needing to perform their job duties. And then a part of our stuff that we're going to be sending out today is the poster that needs to be hung up. So you need to make sure to hang this in a non-conspicuous place in your workplace so that the employees know that these leaves are available to them. Perfect. I will turn it back over to Sheila. Thank you.
Great. Thank you, Miranda. And thank you everyone for staying on. We appreciate that. That was some great information. We do have a few questions for those of you that are still on. In the interest of time, if you need to hop off, we thank you very much for joining. And as Miranda mentioned, we will definitely be sending out that employer's guide, the posters, the presentation today, and we will also send out any chat questions that we've had as well. So let's go ahead and ask some of those questions that we had. Miranda, I do have a couple questions for you. Can an employee use both the PHE and the PSS time?
Yeah, so both of those times are kind of two different buckets of time. So both of those times are available to the employees.
Great, thank you. One other question for you. Do the balances need to be printed on the pay stubs for both of those buckets, if you will?
So I have not seen that needs to happen, but you do need to have good record keeping. So obviously on a paycheck is an easy way for the employees to visibly know how much they've used and for you to be able to track that. But I haven't seen that it's a requirement, but it is a requirement to keep track of how many hours they've accrued and how many hours that they've used for the paid sick time. And then for the public health emergency leave, you know, to track how much they've used. So at ESI, we do have pay codes that we can bucket those times in so that you can visibly see and the employees can see.
Great, thank you. Thank you. Cheryl, I do have a couple of questions that came in for you. I know you don't have a crystal ball, but do you plan to see, or do you think that there would be a continued increase in unemployment fraudulent claims?
That's a great question. Since the extension of the, you know, the extra $300, that kind of thing, I don't see it slowing down at any time. You know, but the more that we put in some of these actions in place, and like you said, you know, the FBI, the Department of Labor, this is being addressed federally. So, you know, if there's anything they can do or give some money to the states, they are trying to improve the technology of the state workforce offices, but that they have a long way to go to do that. So I don't see that coming very soon, but it's, you know, this kind of highlighted a hole in the system. And so a lot of it is technology because there's so many manual processes still across the country in different states. So hopefully this shines a light on that and they can get some resources for it.
Great, it's definitely very scary. Let's see. Oh, here's a great question for you, Cheryl. If companies or employers did not previously take part in the mandated FFCRA, or, you know, once it became voluntary, if they didn't prior, can they implement it now?
Yes, and vice versa. You can, they don't have to be connected at all. And if in Q1 you only did the emergency sick leave instead of the FMLA, you want to flip flop. Yeah, they're not connected. You can do that.
Okay, great. Taryn, I have some questions for you. Will ESI be sending out the Cobra notifications to ESI employees?
Great question. Yes, we will be sending out those notifications and we will take care of all of the qualifying timelines as well as sending out the end of subsidy notifications that are required.
Okay. And one last question for you, Taryn. Are the employers responsible for the cost of the Cobra subsidy during the 18 months that the employee is qualified for?
So not the cost for the entire 18 months, just the cost from the April 1st start date to September 30th end date. So the employers are responsible for covering that cost, and the responsibility lies on who the premiums are being paid to, which being part of the PEO and part of the master plan, the PEO will be taking that cost, as well as taking care of the 941 tax filings to recoup the funds.
Got it. Okay. Let's see. Looks like that might be all the questions I have for now. Oh, it looks like we might have one that come in the chat section. Just 1 second. Let me check that. That's all I have for now. Those of you that are still on, if you have any questions, please feel free to put those in the chat section. We have posted our webinar survey in our chat section. So if you'll just take a few moments to copy and paste that to take our webinar, we'll also be putting that in the email that we're sending out with all the literature and recording of this webinar to you. I believe that's all I have. Panelists, do you have anything else?
Nope. Thank you, everybody, for your time.
Thank you, everybody.
Great.
Nope.
Thank you,
Thanks,
everyone,
for
and
joining.
enjoy your day.
Bye.
Bye.
Bye,
Thank
guys.
you.
Thank you.